Okay, the third question?
Yeah, about green tea, I have a cup of green tea every morning, but is that enough? How many cups of tea, every cup of tea, or?
Okay, so most of the studies have been done using capsules, high amounts of capsules per day. In the studies that they're looking to treat a tumour, they are using, sometimes.
Is it green tea capsules then?
Yeah. They still contain caffeine, so you still have to watch out before bed and things like that, and blood pressure wise and usual caffeine precautions. But they take several a day in the studies that are looking to improve a tumour alongside therapies. The ones that look at green tea and prevention of cancers, they're usually the full cups, and they're the Chinese-based studies that have shown reduction in colon cancer in men and women. So yeah, it's main for our population. It's looking at the capsules really. If you could get a decaffeinated green tea, that might be an option.
Tesco zone, and it does say the green tea, but it does say on it decaffeinated.
Okay, yeah, if they've taken the caffeine out, that's good. But you'd probably need 8, 10 cups a day. And the problem is it doesn't taste that great, in my opinion.
Okay, another question there?
Yes, it's concerning the omeprazole or PPI with Creon. Your booklet recommends that. Could you explain a little bit more?
Okay, so just because you're on Creon, it doesn't mean that you have to have the PPI to make it work. You have to have a problem with producing too much acid in the first place. So usually reflux, heartburn. You'd then be put on the PPI drug, and then that would reduce your levels of acid in your stomach to normal levels to allow the enzymes to work. Not everyone needs, the PPI.
With the probiotics, are the probiotic drinks you can buy in the supermarket worth drinking, or does it have to be tablets?
They have got studies, so Yakult and Actimel, I think are the two which are officially allowed to make claims in the EU because they've got studies backing them. The benefits might be lower than a higher dose of bacteria. So, for example, VSL-3 is the highest dose of bacteria that you can get in a sachet form, and they also have very good studies, and they're prescribable as well, but that you don't get the pleasure of having it as a ready formed dairy drink. So it's up to you really. They're also more expensive.
Yeah.
You mentioned when you take the Creon, you said take it with your first mouthful of food.
Or just before, within a few seconds.
I do take VSL-3, as you mentioned. I was told by my doctors that wasn't on prescription.
By most GPs won't prescribe it.
Right.
Because it's expensive.
I was going to say, so how can I avoid paying that cost?
There is no way really. We're not prescribers of VSL. No. We have to buy it.
Is there any other alternative that might be a little less expensive, that might be as good, that would be prescribed?
There's nothing as strong as that, or nearly as strong as that. There is another one which is a capsule which you can buy from most big chemists called Biocult. It's one a day, but there's nothing nearly as strong as VSL.
Okay. And with regards to VSL, I've had differing comments about hot drinks with it. I know you mustn't dissolve it in a hot drink, but can you? I tend to like to have it in the morning, but I'd like a cup of tea in the morning as well. Is that possible or not?
I'd wait a little while, say 10-15 minutes, just in case. You should go by their instructions, though, I think.
Any other questions?
If you feel sort of reasonably healthy, do you need to worry about what you've just been talking about? Should we be
Wow,
taking all the,
were you
should we be
paying
take-
attention at the end? As long as we keep an eye on your blood tests, and if you haven't had your vitamins tested for a while, I can't remember what you're on, but don't tell me on film. But yeah, we just need to keep an eye on you, and as long as you're happy.
If you're taking Creon and you're taking other medication as well,
Yeah.
is there any preferable way to take it? In other words, do you take your Creon with your meal? Does it matter if you take your tablet first, then your Creon? And are there any medications you might be taking, like calcium supplements, iron supplements, or anything else that will affect the Creon, or the Creon will affect it?
No, it's only the omeprazole or the lansoprazole, pantoprazole that you need to worry about in relation to it. Yeah, but just also beware that if you're not digesting your food properly, and the medication gets caught up in the stools that are going to be eliminated quite quickly, there's a chance that you might not be absorbing medication properly as well. I haven't thought about that before, but thinking about it, theoretically it's...
I thought that, if everything's going to be absorbed, then you need to get
going. If it's rushing through you quickly,
yeah.
So Creon or other drugs that you're prescribed are very important.
One here and then there.
You mentioned about taking the enzymes
Yep.
with the first mouthful.
Yeah.
If you're into your meal and then suddenly you remember the tablets, is there any point in taking them at that stage?
Yeah, and especially because they will. I mean, the stomach doesn't empty its contents into your small intestine that quickly anyway. If you've got more fat in there, it takes longer for it to leave your stomach. So it will start opening up the capsule. The enzymes will start working and breaking down food, but it's just not going to be as good as it was before.
Because I will take one tablet and then I may have a couple of mouthfuls and I'll take another tablet rather than swallow them all
Yeah,
down.
as long as it's within a few minutes, yeah.
Thank you.
Thank you.
I think I read in the book that you shouldn't drink alcohol with a meal. Is that?
In which bit? Was it the carcinoid triggers?
I'm not sure. What's the general thing about that?
So the alcohol can cause carcinoid syndrome triggers in some people, not everyone.
If you don't have that problem, then there's no alcohol's not a problem.
And possibly it shouldn't go with Creon either. But the verdict's out on that one. There's a couple of studies that have said you shouldn't have alcohol with the enzymes.
Could I just ask why?
I think it disables the enzymes. So what alcohol does to our own pancreatic enzymes, and why some people end up with a runny tummy the next day is because alcohol disables them. So it's theoretically possible it might do the same to these other enzymes.
I just wanted to make a comment that experience about Creon
Yeah.
is having gone to the GP to prescribe it. I'm not sure if everybody else has found the same, but they are desperately keen to give you the 10,000 things, of which you have to swallow half
Very
a
good
bottle at a
point.
time.
Yeah.
And we had a bit of a ding-dong. I've now got the 25,000s, but it took a kind of a negotiation to be able to get those prescribed.
Yeah, I think it's because it sounds like a big number, but 10,000s are only really to be used in children, not adults. They can be used if people have swallowing problems and they can't manage the bigger capsules. That's fine, but they need to know that they're going to take, up to 8, 9, 10 sometimes per meal, which is a bit of a hassle. But when you think about how many enzymes are squirted out from your pancreas per meal, it's about 1 million. So the dose actually might go up in the next couple of years. What we're actually telling people.
Following up with the Creon, if, for example, you have to take the Creon at the beginning of the meal,
yeah,
and then what will happen if the meal is going to be quite long, like a family meal or in Christmas, and then in the dessert, it's gonna come up like a very fatty dessert. What is the advice for?
Okay, so you take your Creon, which could be 75,000, 80,000 units, and then if you're having a dessert or you're going out for a multi-course meal, then you still need to take more Creon if you're having your dessert or another course. So another couple of capsules, basically.
Yeah. Yeah. You haven't mentioned Equestrian Light, and I have to take Equestrian Light, and
yeah.
I take 80,000 to 40,000 capsules.
Yeah.
But I was told originally to take one sachet in the morning and one sachet in the evening, and it was giving me nothing but grief.
Okay.
And then I changed it to, with permission, of course. And I changed it to taking the two sachets at night in the same glass. So, you know, like doubling up the water and taking, say, around about 8:30 when I had no more drugs to take. And things have been 1,000 times better.
Okay, well that's good. I'd just do what works for you.
Yeah, yeah. But can I just expand on what you said? If I'm eating a meal and I take 280,000 capsules, and then sometimes you have to wait a long time for the sweet,
yeah.
particularly in my house.
Yeah.
Does that mean you have to take another Creon tablet?
Yeah.
It does.
Yeah, right. Full. Yeah. Depending what dose it is. So if it's something with cream and real, like old-fashioned ice cream with lots of fat in it, you need a couple.
Yeah.
Yeah. Yeah.
I don't think you'd be getting dessert anymore.
Also, it's good for you to bring up the Questran. So the Questran is used when you have bile salt malabsorption, whether you've had the end of your ileum, the end of the small intestine snipped out with surgery, or whether it's just there's bacterial overgrowth as well, can cause that problem if it's in that area. And basically it binds all the salts, so it's one of the things that we try if you've got diarrhea, not steatorrhea.
If you do drink alcohol from time to time, you mentioned don't have it with your meal or with a Creon, but so if you had a glass pre your meal, you know, with time to wait, or a glass afterwards, does that solve the problem?
Yes, it does, yeah. Yeah. Well, it's not official that it does affect the enzymes that you take, but there's a couple of studies, and I don't think they were Creon. I think they were, I don't know, a generic brand. But it might denature them, it might, you know, ruin their effect. Yes, very strong thoughts. So there's no need for anyone with any type of tumour to give up sugar, and it's really theoretically or practically impossible to do that, because we all have starch which ends up as sugar in our bloodstream anyway. Every cell, yeah, well, every cell in our body needs sugar to live. It needs a source of glucose. So you can't give it up because we would die. Full stop.
There was another question? Yeah.
Question regarding the 24-hour urine that we do. You know, the 5-1. That one, yeah. Can you clarify something? Because it says no tea, coffee, alcohol. So therefore, I've drunk Coca-Cola. But is it the caffeine? So you shouldn't be drinking Coca-Cola because it's not listed on that. And can we drink decaf tea?
Yes.
Yeah.
Can you clarify that, please?
Yes, in the list that we give as forbidden
Yeah.
foods when you're going through the process of collecting the 24-hour
That's it, yeah.
urine, For the ones that you're not familiar with it, you need to be like 48 hours doing some diet restrictions, and then another 24 hours during that collection. And it's like caffeine, alcohol, aubergines, olives, walnuts.
So you shouldn't drink Coke.
And those,
Yes, I think it's in the book. Yeah.
if it's decaffeinated, I think it's probably okay. But some of those.
Coca-Cola wasn't listed, didn't say about.
If you have to put every single food or drink that may have caffeine.
So what about herbal teas?
Herbal teas are fine.
Yeah, they should be okay. Some of the foods on there are high in serotonin, so they're only to be avoided pre-test. Okay, so it doesn't influence the blood result.
I done it last week, and I did have Coke on the Saturday, but did the urine on the Sunday. So,
That's fine. One is
but I had one glass.
Yeah, don't worry about it. No. Most of my patients take it because they're the ones that have been referred to me for different types of issues. But as a whole, I'm not sure what kind of percentage.
I don't know the percentage. It's bigger in the people who are taking somatostatin analogs because of the side effects of the somatostatin analogs, and also in pancreatic patients, especially if they have had surgery for removal the pancreas partially or totally. Yeah.
So you should take your Creon, the whole dose, in one go during the meal. Because usually I have one, I take 2 tablets.
Yeah.
Usually I start my meal and have one, and as I eat, take the second. But I can take it all in one go.
It's best to, yeah.
It's best to?
Yeah.
All right. Try that.
Okay, one more last question, if there is. Yeah.
Someone very close to me likes to keep trying to feed me zinc and vitamin C to keep the colds away. Is this could cause any problems?
Zinc and vitamin C? Probably not. No, I think you're all right there.
Oh dear.
Does it work though? Does it work? Have you had a cold?
Okay, well, thank you very much, Sarah, for your informative talk. And thank you so much for coming.